Today's video you do not want to miss and definitely want to watch all the way to the end. In today's video, I am talking to Dr. Nathan Bryan, a biochemist who has published over 100 scientific papers and who has spent the last 2 decades researching a molecule he considers foundational to human health and longevity, nitric oxide. What I learned in this interview with Dr. Bryan blew my mind. But before we talk to Dr. Bryan, I have noticed that only about 42% of those of you watching regularly are actually subscribed. Now, subscriber count is not everything. In fact, I honestly feel we have one of the best communities here on YouTube, regardless of size, and thank you for being part of it. But when subscriber count matters is when I'm trying to bring interesting people like Dr. Bryan on this channel. So if you haven't already, please take a moment to hit that subscribe button. It is absolutely free to you, brings good karma your way, and allows me to continue to bring you interesting people like Dr. Bryan. Without further ado, let's talk to Dr. Bryan about nitric oxide. Thank you so much for being here, Dr. Bryan. It's really great to have you on the channel, and thank you for taking the time.
Thank you. It's an honor and pleasure to be with you.
Your mission is to educate on a molecule you call foundational for human health and longevity, nitric oxide. I recently made a video actually talking about a topical nitric oxide producing product that you came out with. So in that video, I briefly touched on nitric oxide, what it is and the importance. But I have to admit, I always think of myself as pretty knowledgeable when it comes to health and longevity. But when I researched nitric oxide, I was shocked how little I knew about nitric oxide. So can you tell us just a little bit, or not a little bit, as much as you would like to, about nitric oxide, why you think it is such an important molecule?
Sure. Well, this conversation, we're going to change all that. Right? We're going to educate and inform everybody on this molecule, nitric oxide. Now, nitric oxide is a gas. It's naturally produced in the human body. It regulates many important biological functions like blood flow and circulation and tissue oxygenation. It tells our own stem cells to mobilize and differentiate. It activates the mitochondria within every cell in the body to make more energy more efficiently. It prevents the ends of our chromosomes from getting shorter, so it extends our lifespan. So what we found over the past 30 years is that the older we get, typically we lose the ability to naturally produce this molecule. And the loss of nitric oxide production is now recognized as the earliest event in the onset and progression of all age-related chronic disease. So if that's not foundational and important, then I don't know what is.
Yeah, I was going to save this question for later, but since you just brought it up, you say we lose the ability to produce it, like so many other things, unfortunately, as we age. But I have learned in my research that nitric oxide is tightly, or estrogen is tightly tied to the nitric oxide cycle. So does that mean when women go into menopause and estrogen flatlines, we see even more of a dip in nitric oxide production than men do?
No, you're exactly right. You're spot on. So estrogen, it's a two-way street. Nitric oxide affects estrogen secretion and signaling, and then estrogen activates and stimulates nitric oxide production. So as the clinical data tell us, premenopausal women are at an increased level of protection and risk from heart attack and stroke and cardiovascular disease. But at the time of perimenopause and even postmenopause, where estrogen levels decrease, then women lose that activation and stimulation of nitric oxide. And it's that point when risk of heart attack, stroke, cardiovascular disease, all that we know in postmenopausal women start to occur. So our thought process is it's not just enough to improve hormone replacement therapy and improve estrogen levels or restore those levels. We have to restore the function of nitric oxide production and signaling and give that along with the estrogen to really afford then the cardio protection and the protection from heart attack and stroke and cardiovascular disease. But yeah, there's a beautiful marriage between estrogen and nitric oxide. And, when there's a divorce, then, bad things happen.
So interesting. So it's not only that the decline in estrogen that causes cardiovascular disease and all of that, but there is that connection to nitric oxide.
It's the mechanism of action that describes the increased cardiovascular risk of postmenopausal women.
Mm-hmm. Wow, that's so. We're going to talk about supplementation a little bit later and what to do to increase nitric oxide, but basically, postmenopausal women could really benefit from nitric oxide supplementation or other ways to increase nitric oxide.
No, absolutely. And what we've learned over the past really 25 or 30 years is we know what leads to a loss of nitric oxide production. And so we've got to correct that, and then we can also activate and stimulate nitric oxide production through different diet, lifestyle strategies, and even through product technology that I've developed over the past several decades.
Nobody talks about that. I mean, we're talking about hormone replacement now, finally, which is great, but nobody talks about nitric oxide.
Well, it was I mean, look, the damage that the Women's Health Initiative did to postmenopausal women, and the gross interpretation of data and the public health message that they sent out from the Women's Health Initiative, I mean, has severely damaged women's health for decades. And so I think they're now righting the ship and, starting to understand the importance of hormone replacement therapy, the right hormone, giving the right estrogens, bioidentical hormones, estradiol, not, horse urine, progesterone or Premarin. It's completely different. But now we have to follow the science and make sure we make good public policy and public health recommendations based on science.
And luckily, things like you said are going forward now. The FDA just took away the black box warning on estrogen. So we are going in the right direction. But again, nobody talks about nitric oxide and the connection there. So I'm glad I have you on the channel to learn more about that.
We hope to change that. I think that's going to be the conversation going forward because, look, you can no longer ignore the science. There's over 200,000 papers published in the scientific and medical literature on nitric oxide. And so we understand the mechanism. We understand the pathways of production. We understand when nitric oxide is produced, where it goes, what it becomes, and how it signals. So we have to do better.
Let's start at the beginning. So nitric oxide is naturally produced by the body. There are two ways the body produces nitric oxide, right?
Yeah, so there's an enzyme called nitric oxide synthase. This enzyme is found in many cells. It was first identified in our endothelial cells, which are the single layer of cells that line all blood vessels throughout the body. And this nitric oxide synthase enzyme takes L-arginine, which is a semi-essential amino acid, and converts it into nitric oxide. And it's a very complex biochemical reaction. And then we also understand that there's bacteria that live in and on our body. There's what's called ammonia oxidizing bacteria that live on the skin, that oxidize the ammonia that we secrete in our sweat back to nitric oxide, and it maintains good skin blood flow. There's also nitrate reducing bacteria that live in the oral cavity on the crypts of the tongue, that take nitrate that we're consuming from our diet in the form of green leafy vegetables, or even the nitrate that's formed from endogenous nitric oxide production from the enzyme. And now these bacteria respire on that nitrate and form nitrite and nitric oxide. So those are the two primary pathways how we make nitric oxide in the human body. So once we understand the enzymology and the biochemistry of the NOS enzyme, we can start to understand what leads to a loss of the enzymatic production. And that's things like a high sugar, high carbohydrate diet. It's an inflammatory diet. And so those are the drivers, and it's chronic inflammation, it's autoimmune dysfunction, or it's autoimmune disease, immune dysfunction, and oxidative stress. All those lead to a loss of nitric oxide production. And then when we look at the effects of the bacteria, obviously anything that destroys bacteria, anything that's rendered antiseptic, kills the bacteria, decreases nitric oxide production, and we're starting to see an increase in blood pressure through dysregulation or killing of the bacteria. So then the obvious culprits are fluoride in toothpaste, fluoride in drinking water. Fluoride is in toothpaste and drinking water because it kills bacteria, kills all bacteria, good, bad, or indifferent. And then number two are antiseptic mouthwashes. 2 out of 3 Americans use mouthwash every day, and 2 out of 3 Americans have an unsafe elevation in blood pressure. And number three is antacids, specifically what we call proton pump inhibitors. These are things like omeprazole, prescription, or Prilosec, Prevacid, Nexium, the over-the-counter. These drugs completely shut down nitric oxide production from the enzyme in the lining of the blood vessels and also from the bacteria. And these drugs have really proven to be very deadly over the past, 10 to 15 years. And we're finding that people who have been on PPIs for at least 3 years have about a 30 to 40% greater incidence of heart attack, stroke, and Alzheimer's. So antacids are shutting down nitric oxide production, causing people to have heart attack, stroke, and Alzheimer's.
Wow. Now, fluoride and acids, I can somewhat see, but mouthwash, which is something we use to improve our oral health, and I'm guilty of it as well. I use quote unquote natural mouthwash containing xylitol. So I wanted to ask you, is it just antiseptic mouthwash, such as Listerine, or even the natural ones containing xylitol? Is it any mouthwash?
Well, it's anything that's labeled as antiseptic. So the Listerines of the world, you see the commercials that say they kill 99.99% of the
Mhm.
bacteria in your mouth. I'm flabbergasted that these companies advertise this. They're proud of it. You see it on
I'm part of
TV.
it. Yeah.
They're sterilizing the human body. And today we know that every single age-related chronic disease is associated with dysbiosis. So
Mhm.
why in the hell are these companies advertising that they're killing 99% of the bacteria, decreasing nitric oxide production, causing an increase in blood pressure? Increase in blood pressure is the number one driver, the number one killer of men and women worldwide. So to answer your question, anything that's alcohol-based, antiseptic, chlorhexidine, chemical-based is killing the entire microbiome and it's causing human disease. Now, things like xylitol, natural mouthwashes, to be honest with you, we just don't have any data on
Mhm.
those because there's so many different mouthwashes out there. But here's what I tell people, as long as you maintain a healthy microbiome, have normal salivary pH, avoid mouth breathing, avoid fluoride, avoid mouthwashes, then these good non-pathogenic commensal bacteria will repopulate, maintain normal improvement and diversity of the microbiome, and we can maintain adequate nitric oxide production. And now we're finding that if people stop using mouthwash, get rid of fluoride in their toothpaste, stop taking antacids, their blood pressure becomes normal. But you don't even if you're admitted to the hospital, no matter if it's trauma, if it's influenza-like illness, for surgery, elective surgeries, they automatically give you omeprazole, an antacid.
Mhm.
And now there's over 100 million prescriptions written every year for proton pump inhibitors. And now there's data showing that maybe two out of three, not maybe, two out of three Americans are using an over-the-counter
Mhm.
proton pump inhibitor. Things like Prilosec, Nexium, Prevacid. These are over-the-counter medications you don't even have to have a prescription for. These drugs and never get off. And what's happening? They're dying of heart attack, stroke, and Alzheimer's. If I wanted a prescription to make Americans chronically ill and dependent upon drug therapy, I would put fluoride in the drinking water. I would put fluoride in the toothpaste. I would encourage you to use mouthwash to kill all the bacteria. I would tell you to take a bath at least 2 to 3 times a day. Use an antibacterial wipe every time you get on an airplane or every time you do something to sterilize the human body and get your cholesterol below 200. That's a
Yeah.
perfect recipe for chronic disease. And
Yeah.
that happens to be the standard of care.
Yeah. It's very sad. Now we know now the importance of nitric oxide and that it does decline with age. Is there a number when it starts to decline? Is it around 30 or something like sarcopenia, or is it that's when everything goes south is around 30? Is that it? Yeah.
Well, what we're finding is if you look at the general population and you only select for different age groups like 10 to 20, 20 to 30, 30 to 40 different decades. What the data clearly show is that by the time we reach 40 or 50, we've lost about 50% of the nitric oxide. But
Okay.
there are people that, are what we call outliers, and they're 20-year-old kids who have the nitric oxide of a 60 or 70-year-old. And then, I'm 52, but I've got the nitric oxide production of a normal, say, 32-year-old.
Mhm.
So we know how to shift this curve to the left and to the right, and now we know how to prevent the age-related decline in nitric oxide production. And that's the most important message there is understand what your nitric oxide producing capacity is. And if it's compromised, you have to take steps to restore it. And then the next question is, well, how do we know that? Well, because nitric oxide is a gas that has a half-life of less than a second, you can't go to your doc and draw labs like vitamin D and get a number, then treat that number. We have
I
to
was going to ask you that. So there's no way to measure it. Yeah.
No, there isn't. We have to rely on symptoms, and there's some medical devices out there that are FDA clear that can give us an indication of what we call endothelial function. But here's what we tell people. Your nitric oxide, your ability to produce nitric oxide is compromised if you have erectile dysfunction, if you have an unsafe elevation in blood pressure, if you can't exercise for 15, 20, 30 minutes without getting short of breath, tight of chest, if you develop insulin resistance is a symptom of nitric oxide deficiency, or if
Uh-huh.
you're starting to develop brain fog, mild cognitive impairment, dementia, and Alzheimer's. So these are all the steps as you progress into nitric oxide deficiencies.
Now, how come we never hear anybody mentioning insulin resistance and nitric oxide in the same sentence? Nobody, I don't think, knows, aside from you, that there is a connection.
Yeah, no, we published this, I believe, in 2011. So almost 15 years ago, we published this, the dependence of nitric oxide for insulin signaling. Because for insulin to do its job, insulin binds to an insulin receptor, and then it starts an intracellular signaling cascade, which eventually leads to glucose uptake by GLUT4. We've clearly shown that if the cell can't make nitric oxide, GLUT4 never gets the signal, so it can't bring glucose into the cell. And we call that insulin resistance. So insulin resistance is a symptom of nitric oxide deficiency. And in fact, metformin, the main anti-diabetic drug, activates an enzyme called AMP kinase, which then turns on nitric oxide production. But if you can't make nitric oxide, then metformin or glucophages really doesn't have very good therapeutic application or utility. So now what we're finding is if we give nitric oxide, you can improve glucose uptake, you can sensitize the cell to insulin, and you can maintain normal insulin signaling, and you can overcome insulin resistance and diabetes. But again, because there's not a prescription drug yet, we're working on that. For insulin resistance, I mean, it's been known for decades that diabetes is curable, preventable, reversible, and treatable by diet and lifestyle.
Mhm.
But nobody wants to get rid of sugar, nobody wants to exercise, everybody wants to take a pill and not change their diet and lifestyle. And we've been
Yeah.
very fortunate and blessed to understand what's the mechanism. Now that we understand the mechanism, we can make everything that they do clinically work better because we understand the mechanism of action.
So how about all the drugs like Ozempic and all of these drugs coming out on the market now? How do they affect nitric oxide production, or do they even affect nitric oxide production?
I'm not convinced that they're affecting nitric oxide production. I think they can be very effective drugs when used in the right patients. So the morbidly obese people who have not been able to lose weight because for whatever reasons, I think these can be very effective drugs to get them to decrease their appetite so they're not eating as much and so they can then maintain an exercise regimen and begin to lose weight. I think there's also some data coming out on kind of micro dosing with the GLP-1s, like the Ozempics, that can improve metabolic flexibility. And these are beyond the weight loss effects of these drugs. But again, like any other drug, they don't come without side effects. And so you have to manage and mitigate the gastroparesis. There's clear data now that they're, causing some vision loss in some patients. And so these are very serious side effects that you just have to mitigate. But the beauty of these, the mechanism of action of how these work is very well elucidated. So once you understand how the cell responds to any drug, not just the GLP-1s, then you can mitigate the side effects and make these drugs more effective. But I think, they can be very effective for weight loss just because they're decreasing consumption of calories. All they do is increase satiety. So you're not
Mhm.
eating as much. And Americans have been conditioned to graze throughout the day. So the GLP-1s are basically just forcing you to do intermittent fasting and caloric restriction, which we've known for decades that that's the most effective weight loss regimen, and it induces longevity. People live longer when they're doing caloric restriction and intermittent fasting. Some people just need these drugs to curb their appetite so they're not eating throughout the day.
But on your end, there's no concern as far as these drugs affecting nitric oxide. You don't have a connection there at this point.
No, I don't think a connection's been, these drugs have been on the market now for several years, and I'm not aware of any published data on how they're affecting nitric oxide production. But here, I think indirectly we can infer how they're working because if you're decreasing consumption, you're probably decreasing carbohydrate consumption. You're lowering blood glucose, you're lowering insulin levels, and that's preventing the dysfunction of the enzyme that makes nitric oxide. So when you have an elevation of blood sugar, glucose sticks to the enzyme. Glucose is glue, and it renders a lot of enzymes dysfunctional. So if you can maintain normal blood glucose, then nitric oxide production improves, and many other enzymes can maintain their normal function.
Okay. So let's talk about that a little bit more. So we know how important nitric oxide is and that unfortunately our production declines with age. What are some things we can do to keep that production at a higher level?
Well, you only have to do two things. You got to stop doing the things that disrupt it and then start doing the things that promote it.
So no
Right? So
mouthwash, no fluoride, no antacids.
yeah, get rid of fluoride.
Mhm.
If you have fluoride in your drinking water, you're almost forced to get a home filtration system. Now that this administration is moving toward completely eliminating fluoride from the drinking water because it makes no sense. It's making people sick. It's a neurotoxin. It shuts down your thyroid function, and it's an antiseptic. All three of those are bad, and it
Mhm.
provides zero benefit. So get rid of fluoride. Stop using fluoride toothpaste. Throw those out. They're toxins. And if you read the back of your toothpaste label, and I encourage you, if you're listening to this, go get your toothpaste. If it's Crest, Colgate, Aquafresh, whatever fluoride toothpaste, it'll tell you only use a pea-size amount on your toothbrush because that pea-size amount has about 5 milligrams of fluoride. But most people are putting the goop all over their entire bristle. So now they're getting 50, 60, 100 milligrams of fluoride. And then it also tells you if you swallow this, called poison control. Well, the molecular weight of fluoride is, I think, 27. You don't even have to swallow this. It's so small, it's absorbed to the mucous membranes. So anytime you brush your teeth with fluoride, you should follow those instructions and call poison control because you are being poisoned. They tell
But
you this right on the label.
what do you tell people like my husband? I have been fighting with him for the whole time I've known him about fluoride because I don't use fluoride. I haven't since I was a child. And he says, but then you get cavities.
No,
What do you
that's
tell
not
people?
true. We thought that 100 years ago. But
Yeah.
science has progressed over the past 100 years. And we can't do things today because we did them 100 years ago when science tells us that it provides no benefit and it's all risk. I made a fluoride-free hydroxyapatite-based toothpaste, and so you should just switch it. And when he tries a non-fluorinated toothpaste, his breath is going to be better, his oral hygiene is going to be better, his systemic health is going to be better, and he's going to love it.
Isn't the opposite true for adult teeth? Too much fluoride actually weakens them, right?
Yeah, it causes fluoridosis. I mean,
Yeah.
you see this all the time,
Yeah.
and it shuts down your thyroid function. So,
Yeah.
so that's number one. You have to get rid of fluoride. Number two, if you're using mouthwash, you must stop.
Mhm.
And then number three, if you're on an acid, you must wean off an antacid. And then you got to stop eating food that causes an increase in blood sugar. I encourage people wear a continuous glucose monitor for 30 days, and then just eat your diet. If you see a spike in blood sugar, then don't eat that food again.
Mhm.
Because I may be able to eat something that will not cause an increase in blood sugar, and somebody else eats that same thing, and it's going to drive their blood sugar up. So we have to know what we eat that's causing an increase in blood sugar. So those are the four: fluoride, antiseptic mouthwash, antacids, and sugar and simple carbohydrates. Now, if you eliminate those, you've released the brakes on the body's ability to make nitric oxide. And then we can, throw in some more nitrate-rich vegetables. You can get 20, 30 minutes of moderate physical exercise a day, or even now we're seeing 6 to 8 minutes of high-intensity interval training, increase breath rate, increase heart rate, do nasal breathing, do mouth taping at night, provided you have an open airway, and then 20 to 30 minutes of sunlight a day. And
Okay.
really, it's that simple. And these are cost saving, right? Because you're not eating as much. You're getting rid of fluoride toothpaste. You're getting rid of mouthwash you no longer have to buy. You're going to stop taking antacids, which save you money. And then exercising out in the sunlight, breathing through your nose. I mean, it's really that simple. And then when all else fails, I make products that actually make it for you. So if your body can't make nitric oxide, then my products deliver it for you. And we call it hormone replacement therapy because nitric oxide is a hormone.
Okay. Now, really fast before we move on, you said nitrates from green leafy vegetables, which I think is important because people are going to start eating hot dogs saying, okay, I'm getting nitrates right here, but that's not what we want. We want them from green leafy vegetables.
Well, I mean, all we have to do is look at the math. I mean, 85% of the nitrate we get from our diet comes from eating green leafy vegetables. Only
Mhm.
5% comes from cured and processed meats, and the other 10% comes from swallowing our own saliva. So this whole notion that, obviously nitrite and nitrate are used as curing agents for cured meats, but you really can't eat enough of those to get enough nitrate to see the benefits. It comes from green leafy vegetables.
Good. I'm glad you're pointing that out because there are some people that are against vegetables nowadays too,
No. Look, you have to find a diet that works for you. There is no one size fits all.
Yeah.
I think for me, I'm not a big extreme diet, straight vegan, straight carnivore. I think we've evolved to get our nutrients from a diverse source. And so what I like more of a, animal protein. I'm more kind of ketogenic, not straight carnivore, but more keto, less carbs, throw in a few green leafy vegetables. I'm a meat and potatoes salad kind of guy, and that works for me.
I'm sure you have an opinion about antibiotics as well when we're talking about destroying microbiome. So I would think that they are not that great for nitric oxide production as well.
No, they're not. Look, antibiotics are essential. And if you've got a pathogen or you're septic, then the judicious use of antibiotics has saved millions of people's lives. The problem is we've gotten too lenient on the use of antibiotics. You go to the doctor with an influenza-like illness, a viral infection, and the first thing they do is want to give you an antibiotic.
Mm.
Antibiotics have no effect on viruses. Right. So then it exacerbates. An unhealthy microbiome actually makes you more susceptible to viral infections. Because if you've got a healthy microbiome, there's bacteriophages that actually go and maintain and surveil the terrain for viruses. So people who have a healthy microbiome are more resistant to viral infections. If you have a viral infection, you give somebody an antibiotic, it's going to make them more susceptible to viral infections. So that's never made sense to me. But I think we have to be more judicious in the use of antibiotics and only use them when absolutely necessary.
Which is starting to happen with animals now, thank God. Before I had Bean, my puppy, I had a dog who got bladder infections very frequently, and without even testing what bacteria they put on antibiotics.
Yeah, yeah.
Now the vet said unless they're symptomatic, they actually don't prescribe antibiotics because of the antibiotic overuse. So it is happening with animals, but with humans, I think we have a ways to go, unfortunately.
Yeah, yeah. Now we have to support the microbiome. We can't kill it. I mean, the data are very clear.
Yeah. Now, you mentioned that nitric oxide is a hormone, which is interesting. It's also a neurotransmitter, correct?
It is. It's a neurotransmitter. It's part of how our neurons in the brain fire and communicate with one another. We published in, I believe, 2010 or 20 or no 2007 that nitric oxide is actually a hormone. It's produced in one organ system, which the endothelium, which is the lining of the blood vessels, and it has systemic effects. So that realization is what allowed me to develop nitric oxide based therapies because that told us that all we have to do is generate nitric oxide in one biological compartment. In hormone replacement therapy, like for women, if we want to give estrogen, we don't have to give shots into the ovaries of estrogen for it to work, right?
Mm-hmm.
We can use transdermal, we can use intramuscular. Same thing with men. We don't have to give shots in the testes to give testosterone replacement therapy. We can give it in a sublingual, intramuscularly, and transdermally. Because once it's absorbed or created, it's transported throughout the body and has its endocrine effects. And that's the same with nitric oxide. So I make nitric oxide in the oral cavity through an orally disintegrating tablet that then's absorbed buccally, it goes systemic, and it has the systemic effects. And that's how what we do is so different than any other so-called nitric oxide product on the market. Because we do hormone replacement therapy. Number one, we know how much nitric oxide is necessary to be produced to recapitulate nitric oxide production and signaling. And we produce that over a certain period of time in the oral cavity. And we can completely normalize nitric oxide production.
Wow. Now, sticking with the supplementation, I don't know if you're familiar with Kate Wickham's, but she is a doctor that did some research on nitric oxide and how it affects females, especially female athletes. And she is saying that female athletes in their reproductive years, or not necessarily athletes, but just women who want to benefit from nitric oxide for physical performance, that in their reproductive years, nitric oxide actually is a hindrance to performance, versus in menopause, again, because the estrogen flatlines, it increases performance and VO2 max. Have you come across that as well?
No, I think it's a misinterpretation of data, which happens all the time in the nitric oxide field. I'm not familiar with her.
Mm-hmm.
I don't argue with data, but a lot of times there's a misinterpretation of data. So nitric oxide is an extremely important ergogenic aid, no matter what period of life you're in. And in terms of reproductive health, nitric oxide helps with ovulation. And we observed this in the research lab years ago that we put mice on nitric oxide supplementation and their conception improved, their litter size grew, and it was affecting on both sides, sperm motility and
Mm-hmm.
the viability of the egg on the female side. So nitric oxide is extremely important for reproductive physiology. But I think what she may have been, and again, I'll just speculate here, but if you're a well-trained athlete and you have good endothelial function and you give nitric oxide supplementation, there's only a little room of improvement. We see this in high-performance athletes, Olympic
Mm-hmm.
athletes, professional athletes. You give nitric oxide, you may see only a 1 to 2% improvement in performance because they're already up here at the top. Now, if you take somebody who's 40 or 50, say menopausal, the weekend warrior, average Joe, and you give them nitric oxide, it improves a lot because they have a lot of room to improve.
Mm-hmm.
And nitric oxide can make up that delta. But I think it's probably a misinterpretation of data.
Yeah. So you're actually saying that if somebody has struggle conceiving, nitric oxide supplementation could be beneficial.
I think it could be beneficial. Again, we don't have any randomized placebo-controlled clinical trials on that, but understanding the biochemistry and physiology of nitric oxide, it makes perfect sense. There are a number of reasons why people can't conceive either on the, it could be low sperm count, which we know, sperm count in men has declined rapidly over the past 50 years. It could be sperm motility. They just don't make it to fertilize the egg. It could be on the female side. It could be, unviable eggs. It could be, a disruption in thyroid function, and you have to restore the thyroid. It could be other, hormone disorders. But
Mhm.
it's multifactorial. So I'm not going to sit here and say that nitric oxide is going to, make people conceive, because you have to understand
Yeah.
the cause for that and then address that.
But it could be an easy try that doesn't have any risks.
Oh, for sure. We certainly know that it improves sperm motility. I think
Mhm.
if men start to detoxify and get their sperm count up to where it was 50, 60 years ago, I think conception will improve. And again, there's so many hormone disruptors in the environment that women are exposed to. All the chemicals they're putting on their body for lotions and potions and skincare, and then just the plastics, the xenoestrogens, all that is disrupting hormone and making it very difficult to conceive.
Yeah. Now that makes me go back to erectile dysfunction, which you said earlier is one of the earliest symptoms of nitric oxide loss. So rather than going the Viagra route, if somebody would just get their nitric oxide production up naturally through diet and exercise and all of those things, or take a nitric oxide supplement, they could avoid taking pharmaceuticals, right?
Now, that's the goal of medicine, to understand the root cause of disease to the extent that you can correct it.
Hmm.
And our body's never deficient in synthetic compounds that inhibit biochemical reactions, right? We want to get what we do is called restorative physiology. We want to improve nitric oxide production, improve vasodilation, so that when we're intimate or we're stimulated, we can dilate the blood vessels of the sex organs and get engorgement in both men and women and have normal sexual function. That's the goal. And when we do that, there's no need for PD-5 inhibitor therapy like Viagra or Cialis or Levitra, because we're allowing physiology and the enzyme to make nitric oxide to do its job to dilate the blood vessels. So we get penile engorgement, we get clitoral engorgement, labral engorgement, and women have orgasms, and we increase our libido and increase our sexual function.
That's the other thing. We never think of women. We always think of erectile dysfunction,
Yeah,
but women in menopause, it's oftentimes difficult. And I wonder if there's also because of that extreme loss of nitric oxide, if that has something to do with.
absolutely. If you look at the hemodynamics of orgasms in women, the orgasm occurs when there's an increase in pressure, an increase in clitoral pressure, labial pressure, vaginal pressure. And that pressure is due to an increase in volume, blood volume. And you can only increase blood volume through vasodilation, and that occurs through nitric oxide. So in postmenopausal women who are estrogen deficient, nitric oxide deficient, even they may be stimulated or want to be intimate, but if you can't dilate the blood vessels, there's no engorgement, there's no increase in volume, no increase in pressure, and women become anorgasmic and they lose lubrication. It's painful sex, and they can't reach orgasm. And so what we're finding is if we can restore the vascular function, the function of the enzyme in the vascular bed of the sex organs, we can dilate the blood vessels, we can improve lubrication, we can improve pressure and orgasms, and everything works better. And mechanistically, we know exactly how this works and how it's supposed to work.
It's just nobody talks about it.
Nobody talks about it.
Yeah. But just estrogen replacement alone would somewhat help with the nitric oxide production as well, right? Since it stimulates nitric oxide
Well,
production.
it's we have to focus on restoring the function of the enzyme. So
Hmm.
if we can restore the NOS coupling and the function of the enzyme, if we give back estrogen through hormone replacement therapy, then when you activate and stimulate the enzyme, it can actually produce nitric oxide on the other end. And
Okay.
that's the beauty of our technology, because it recouples the NOS enzyme. So when people take our nitric oxide releasing lozenge and do hormone replacement therapy, you see really a vast improvement. Not only you regain the cardioprotection of estrogen, but your libido improves, your blood pressure normalizes, your energy levels improve, and it's not it's the system. We've got to fix the system.
Well, this is so fascinating to me because, again, nobody talks about this. Hormone replacement is something I am really passionate about and talk a lot about on my channel because I was anorexic when I was younger, so I struggled with my hormones basically my whole life. But even though that is something I'm so passionate about and have done so much research on and talked to so many experts about, I had no idea about the nitric oxide part. So this is so fascinating to learn all of this.
Yeah, no, it's foundational. I mean, look, hormone replacement therapy is life-changing for men and women. But we have to understand how these, number one, how to do it correctly, how to
Hmm.
give the right dose of different hormones to restore. And what we want to do is we want to recapitulate nature. We want to reproduce what the body would normally do. And that
Yeah.
requires an understanding and really your biology versus another lady's biology, or my biology versus somebody else's. And so you have to custom tailor this to each person. The beauty of nitric oxide is, it's agnostic to sex, race, age. So when we give nitric oxide, it always does the job because we're giving a certain amount of nitric oxide over a certain period of time. It dilates blood vessels, mitigates the inflammation, inhibits oxidative stress, and corrects the immune dysfunction we see in all chronic diseases. And that's the magic of nitric oxide.
That's fascinating. Now, your nitric oxide product, or I would think most nitric oxide products are available on the market, which are becoming more and more popular, are basically made from beetroot, correct?
Now, I think that's another myth that's been perpetuated over the past 15
Okay.
years.
See it. What do I
The
know?
beet, no, beets are not nitric oxide. Don't believe all the commercials you're seeing.
They're nitrate rich, correct?
Yeah,
And
the
then,
problem is, yeah, nitrate can be utilized as a source of nitric oxide, but again, you must have the right oral bacteria and you must have stomach acid production. But as we've discussed, most people are using fluoride in their toothpaste. Not
Mhm.
72% of the municipalities have fluoride. So even if you eat your vegetables or take beets, you're not going to get a benefit from it because nitrate is inert in humans. If you don't have the right bacteria, you consume these and you just sweat it out, you poop it out, and you pee it out.
Okay.
So beets are not nitric oxide. Nitrate is not nitric oxide. And all these arginine and citrulline based products are basically useless because we're never deficient in these amino acids. So it makes no sense to supplement them.
Okay.
So what we do is completely different. And this is based on my 25 years in academia and research is if your body can't make nitric oxide, then we got to do it for you. But we also got to fix the reason your body can't make it. We restore the function of the enzyme in the lining of the blood vessels. And because this lozenge sits in the mouth for 5 to 6, 7 minutes, it's improving the diversity of the microbiome. It's selectively killing the pathogenic bacteria, and it's improving the body's natural production of nitric oxide. And that's the N101 line of products. And these are not based on beets at all. This is based on biochemistry and physiology of and basically reproducing what the body would normally do.
Let's make the jump to topical nitric oxide. Because
Yeah.
as I mentioned earlier, before I even knew who you were, I was just curious about your product. I'd come across it somehow. And being somewhat of a skincare junkie, I thought, well, let me try this. So obviously, then I did a bit more research and I learned why you came up with this. But tell us, what was your thought about topical nitric oxide or a nitric oxide producing product?
Well, I never had an interest in skincare and beauty. The kind of the origin of a topical nitric oxide came from treating my own dad. Dad had a car accident in 1984, so he's been in a wheelchair, paraplegic for what 40, 45, 46 years now, or 40, going on 41 years. But Dad developed decubitus ulcers, these pressure ulcers that many paraplegics and bedridden people suffer from. So all the wound care docs said we would never heal this. He was 60 something years old, paraplegic, diabetic, hypertensive. And I just refused to accept that. So I started making a topical nitric oxide that I would put in the wound bed. And we took a 4-year-old non-healing wound and we healed it within 8 or 9 months.
Oh,
Because when you understand wound care, most non-healing wounds are hypoxic and there's chronic infections in there. And hypoxic means there's not any blood supply to that wound bed because of poor circulation. So when I started applying nitric oxide topically, I could see the wound bed turn red, get blood flow to it. It would kill the infection in the wound, and then it mobilized stem cells and it healed the wound. So then when the doctors were looking at this, they go, Nathan, that's remarkable. We've never seen anything like this. Can you make something like this commercially? And then, we're developing a drug therapy for wounds, but in the meantime, I developed a topical nitric oxide for skincare because the same principles apply. The
mhm,
skin is an organ just like the sex organs, just like the heart, the brain. And without sufficient blood supply, that organ fails. So what does a failing skin look like? Well, you get fine lines and wrinkles, you lose collagen, you lose hydration, you get acne, you get eczema, you get rosacea, your skin becomes inflamed. So I thought, well, let's apply nitric oxide topically and let's restore blood flow to the skin. Let's recruit capillaries, let's dilate blood vessels, let's mobilize stem cells, let's improve collagen deposition, and the skin improves. Fine lines and wrinkles get better, tone, texture, and clarity improve. And so again, nitric oxide is a gas. So in order to deliver this in a shelf-stable type of form factor, I had to create a dual chamber delivery. So as you
mhm,
know, the N101 serum is 2 chambers. So you
mhm.
take one pump from one side, one pump from the other, you mix it together, and that starts the production of nitric oxide. But this is a remarkable product in skincare and beauty because you can actually see it working right before your eyes, right? You apply it and your skin turns a little bit pink,
Mhm.
and that's because we're increasing blood flow and circulation. We've got 6 published clinical trials on it. It's a game changer in skincare.
Yeah, I shared your studies. They were quite interesting, even though there were some photos with it, which is always helpful.
We get before and afters because that's important. People want to see the
Mhm.
actual results, but we go a step further. We look at microvascular structure and function. We do biopsies. We do see an improvement in collagen deposition. So not only do we see the effects from the outside and before and afters, but we're looking at the cellular and subcellular level and understand mechanism of action. And because once we understand mechanism, we can make these products better.
Mhm.
We can make every product better.
I'm a big fan of microneedling.
Oh yeah.
So I just actually microneedled 2 days ago. You wouldn't know it
No,
because
not
I
at all.
apply your serum afterwards now, and it cuts the downtime, I would say, in half. So that's
Now
how.
we hear that from dozens, probably hundreds of people now. We've got a lot of med spas that use it as part of their protocol, post microneedling or post
Mhm.
procedure, because it makes perfect sense, right? It's going to improve the healing process. It's going to mobilize stem cells. It's going to facilitate a much more rapid healing.
No, I have definitely seen an improvement in healing with that. It's hard to say, does it stimulate collagen or anything, without doing a visual scan or biopsy, like you said. But I can see the physical improvement in healing, definitely, with microneedling. So that keeps me repurchasing it.
That's
Now, when I talked about your serum, I had some questions. For example, can you use it with retinoids? Can you use it with vitamin C?
We have 20% vitamin C in one side of the chamber. So if you're using a vitamin C, a high quality vitamin C, you probably don't need that anymore because we're providing that vitamin C. But what I tell people, if you've got your favorite retinol, hyaluronic acid, skincare products, that's fine. If you don't get away from what works. But to incorporate our serum, you start with a clean face and then you apply the serum first. And that's going to be like, improving vascularity, improving blood flow. Now you can apply your hyaluronic acid or any other product you have. And it's gonna make that product better. It's going to get better delivery, better uptake when you start with the serum. Yeah, but stay away from anything that's antibacterial, um, antiseptic, because the skin has a microbiome just like the mouth, just like the gut. Um, and so we have to support the microbiome, the dermal, the skin microbiome.
Okay, so things like salicylic acid or something, okay? Or you still want to stay away from that as well?
I'm not a big fan of that because it's an anti. Look, if you've got an inflamed skin, I think there are better solutions. The nitric oxide would certainly be a more viable solution to decreasing the inflammation, restoring normal blood flow than using, salicylates. Uh, again, everybody's different and has their own kind of favorite cocktail, but I think the nitric oxide should be foundational for everybody for
Mm.
skincare. And we like to do the lozenge with it in the topical serum. We call it Beauty Inside and Out because you got to, stimulate the microcirculation, open up the microcirculation internally, and then topically we can hit it from the top, so from the inside and out.
Okay. Wow, this has been absolutely fascinating. I could talk to you for hours, but I know that you have another interview, so I probably should let you go. Is there anything else you would like to add?
Now, I would just encourage people to, this is my latest book, The Secret of Nitric Oxide, Bring the Science to Life. We talk about a lot of the science we discussed here in this conversation. Subscribe to my YouTube channel, Dr. Nathan S. Bryan, Nitric Oxide. You can follow me on social media, Dr. Nathan S. Bryan on Instagram, LinkedIn. And then for our product page, it's n101.com. That's the letter N, number one, letter O, number one.com.
I will link it all down below. I just thought of one more question, actually, if that's okay. As far
Sure.
as supplementation, are there any people who shouldn't supplement? Let's say somebody has really low blood pressure to begin with. Would it be not a good idea for them to supplement with nitric oxide?
Now, we really haven't found anybody who wouldn't benefit from nitric oxide. The people with low blood pressure, was a concern before we ever launched the product because nitric oxide is a known vasodilator. And if somebody with low blood pressure, the last thing we want to do is further lower their blood pressure. But the interesting thing about what we're doing with the lozenge is if you have high blood pressure, it'll normalize it. If you have normal or low blood pressure, it's not going to further drop your blood pressure. But there's only two people in the world who need nitric oxide. There's the people who are well and don't want to get sick. There's the people who are sick and want to get well. So if you fall
Mhm.
within one of those two, you need our nitric oxide lozenge.
Okay, now I have one more question. I'm so sorry. Talking to you just brings up all these other
Yeah,
questions. But
the purpose.
when I watched one of your interviews and you talked about the mouthwash and the antacids and the fluoride, the first thing that came to mind is my husband because he does all three of them.
Yeah.
And so I said, baby, you have to stop all of that. It's not good for nitric oxide production. And he said, well, why don't I just take a supplement? Would that be beneficial at all if somebody still continues to do all the other things?
Well, if it's my product, because the problem with all the other supplements, if you're doing these things, those supplements can't work and they don't work because you've inhibited the body's ability to utilize those to make nitric oxide. But yeah, if you've got somebody who's loves their fluoride toothpaste who can't wean off antacids, then they absolutely have to take the N101 lozenge because that's going to be their only source of nitric oxide their body ever sees because they've
Okay.
inhibited the natural production. So the only nitric oxide they're going to experience is our lozenge. And the lozenge is not dependent upon the bacterium. It's not dependent upon stomach acid production. So we produce nitric oxide the same in every single person who takes it.
Okay. So it would still be beneficial, even though it would
Absolutely.
also be better if you stopped
It
all of this.
becomes more beneficial and more necessary for those people.
Okay. That's good to know. All right. Well, I'll order him some.
Yeah.
Well, thank you so much for taking the time. This has really been fascinating. I learned so much. And hopefully at some point we can have you back because I didn't even get a chance to look at the notes I made. I wanted to ask you all these questions, but I just kept thinking of
I'm
questions.
always happy to come back because the field is moving so rapidly, and there's always more questions to answer. But no, I'd love to come back and have another conversation with you.
I would love to have you. Thank you so much.
Thank you, Claudia.